Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne. I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Just weeks into the new year, the Omicron variant is still on the rise. Battling the worst wave of COVID we've seen in some time, city officials and local leaders encourage testing and vaccines. The Bronx currently has the highest positivity rate in New York City, and in some neighborhoods, that number is near 50%. Joining me to discuss the steps needed to address this problem is Cyrille Njikeng, Manager Director of Oyate Group. Cyrille, thank you for joining me.
Thank you for having me.
Now, I understand the fight against this is an effort from the Oyate Group, an organization stemming from the Bronx Rising Initiative. When did your organization decide it was time to take some action?
In the beginning of the pandemic, Thomas Ramos, the founder and CEO of the Oyate Group, was going through. He was running for office in a congressional seat in the 15th district, and he didn't win the election. And while he was running for office, he decided in the midst of the pandemic to stop his campaign to start raising funds so that we can help, alleviate the issues that the Bronx was going through at the time, which was ICU bed capacity unit, ICU unit bed capacity, and then at the time it was, it was still, the pandemic was new, so the issues in hospitals, to have people coming in and being on ventilators and everything was in. So we started raising funds. At that time it was just a couple of people, young men and women from the Bronx, just trying to help. And the more serious it got, then we decided to create the Oyate Group and make this official. So we've been there from the beginning. We've been there from the beginning of the pandemic.
Nice. So can you just explain some of the measures your organization has taken to fight against this?
Being part of the Bronx, we noticed that we're the highest hit in all the 5 boroughs, but we didn't have the resources that we needed to combat the pandemic. So we decided to create a grassroots campaign where we went in most of all the NYCHA facilities and actually knocked at doors and registered. At the time, it was 65 and older that were allowed to receive the vaccines. We registered all the elderly people in the NYCHA facilities, and then we brought in the vaccines in the community centers in the NYCHA facilities. Because remember, at that time, the city was asking people to travel to the Jacob Javits Center or to the Yankee Stadium. Most of our elderly people are on walker. They don't have the power, the strength to travel down the city. So we just brought the vaccine to them in their community center, and it was very successful. Again, it was a struggle because vaccine hesitancy was a great thing at the time. So that face-to-face discussion with our people in our community made a lot of difference, in the process. So we created a grassroots campaign. We brought in the vaccines. We vaccinated almost 35,000 people during that effort, and then we made sure that we register a lot of people to get their vaccines and educated them about the vaccines, because in our communities, most people didn't want to take the vaccines. They were not ready for that.
Yes, I definitely was seeing that. So I agree 100% with what you're saying. Do you have any idea why the Bronx continues to see the highest positivity rates? Do you still think it's connected to vaccine hesitancy?
Yeah, that's one factor, vaccine hesitancy. But I think education is a great part of why we're having, that issue, because most people are not educated. Some people get their information from the social media, people get their information from their TikTok feed, and how real those informations that they get are, So I think the main thing that we should have done from the beginning was educating the people about what they're going through, because again, nobody was prepared for a pandemic, right? It just hit us, and then now we had to go through the motions. And for African Americans and Africans, we've been through a lot, right? We've been experimented on a lot of times. So it plays with our mind, it plays with our psyche to just accept things that comes from the outside like that. But now, with informed people like us, who are part of the grassroots, movement, and we are in the community, we're part of the community, and we're working to bring, resources and help to the community. We're not going to just bring a vaccine to kill our people, right? And even if it's not us, we got our vaccines like in the beginning because we're out there knocking at doors. So if somebody was supposed to die, we were gone long time ago, So I think the lack of education, to answer your question, and then just the vaccine, people are not ready. Some people are still not ready, and even though it's going down now, we have the Pfizer for 5 years and up. The parents that didn't take the vaccine, do you think they're going to take their children to get the vaccines? So it's a very tough, but it's our community. We're from the Bronx. We know how to deal with it. So we're still out there all the time. We have a mobile unit, from time to time you see us posted on Kingsbridge, on 149 and 3rd, on different areas in the Bronx, where we want to meet the people where they are, because you cannot expect people to leave and come and get the information or get the vaccines. You have to go where they are, and that's how we're going to make these numbers go, down.
Now, I think it's really alarming that the numbers are so high citywide, despite seeing stories that more and more people are waiting hours to get tested. Do you still think that testing is as effective as it was maybe several months ago?
Again, I want to be careful on how to answer this, because many factors come in play when it comes to testing, right? Now we have I think I have one somewhere, but we have the kit, the kit that you can go on the CVS and buy and get it, do it yourself. You don't need to go far to do the PCR or do the rapid test, So the question becomes how accountable are we, towards this? How bad do we want to get back to normalcy, if there should be anything called normalcy again? So I think always education, I'm always going to go back there, because I don't think we're doing a great job as a city or as a state to educate the people who need the education, because we have data. The Oyate Group have data that shows the highest people who vaccinated, the list, and we have a whole if you go on our website on oyategroup.org, you're going to see the data is there. Those data show us who was willing to go out and get the vaccines and who was not. So we could use those data and say, okay, let's create some type of educational tool to let the people understand that now, after a year and a half, 2 years, this is not a joke anymore. People are still dying. I got the COVID in December. Throughout Christmas, I was down, and I got all the symptoms in one day. I got loss of taste, loss of smell, flu, body pain, everything in one day. I thought I was dying too, So, but I know that because I got my vaccine, everything just came and left. It wasn't like I was ready to go on a ventilator or something, So it was very mild. It hit me hard, but it was very mild because I was vaccinated. And now when I get my booster, I'm good, So it's education. You have to understand that this is not those times anymore where it was about experiment. Now people are dying. Italy was shut down for months. They lost a lot of people in many countries, shut down. So we have to educate ourselves and get the right information, and then do what it takes to make it happen.
Now, I like that you mentioned a little bit about your experience. Now, if you take a look at your screen, you can see that at this point, many adults and children have received their vaccine. So, people are getting it. But for those who don't have it yet, can you explain why it's necessary in regards to public health? I know you talked a little bit about the hesitancy, but, why do we really want these people to go out and get that vaccine?
Again, this is a black male speaking about this, right? So it's very important, because if we don't get vaccinated, then people are out there who will be carrying the virus over and over, and we that are already safe. And again, I had a discussion with someone who was a anti-vaxxer. No, I don't want to call them anti-vaxxer, but who still didn't believe in that they should take the vaccine, or they're in the fence. Oh, what sense does it make if you were sick in December, you had the vaccine in February or March? What sense does it make? I'm like, no, getting the vaccine doesn't mean that you can't get the virus anymore. But the difference is that you can get the virus, but you're not going to get the type of symptom, like, if you didn't get the vaccine, you'll be on a ventilator, you'll be, passing out and everything, compared to if you got the vaccine. So for those people who are still on the fence, I just want them to do their research, to understand that if we aspire to go back to anything normal, we have to make sure that all of us together are vaccinated, so that it should not be, oh, you can't go in a bar or in a restaurant because you don't have your vaccine card, or you have to wear your mask. People are tired of that. We're seriously tired of that right now. It's time to go back to some type of normalcy. This week I'm taking my kids, all of them are getting their Pfizer shot, because the schools were closed, were shut down in the beginning of they were supposed to be closed on 24th, and they closed 3 days before because the cases were very high in their schools. So I'm as a parent living in the Bronx, I want to be home knowing that my children are not bringing back anything home because someone didn't get their vaccine. So, and that's the next step that we're taking as Oyate Group is going into schools. We have a lot of schools they are ready, line up for us to bring in the vaccines effort in there.
Cyrille, thank you so much for joining me. I really appreciate all the knowledge that you've been dropping. We're going to show quickly just where people can go look to learn more information, because like you mentioned, education is really, really important. But once again, thank you so much for joining me. And we'll be right back with more Open BxRx Tuesday.